Hello everyone. Thank you for joining today's session. As you all know, we have Mega Specialty Month, and this session is going to be about pediatrics. Let me introduce you to our guest today. It's Dr. Chaitanya Datta. So I'm going to tell you a little bit about our doctor. He's done his MBBS from Mysore Medical College, specialization in pediatrics from Jawaharlal Nehru Medical College, and he's been practicing pediatrics since 35 years and has consulted with many major hospitals in Bangalore. So, yes, hello doctor. How are you today?
Yeah, fine. How are you?
Good, doctor.
Yeah. Can we
Thank
start the
you for
session?
joining.
Yeah.
Thank you for joining today, and thank you from Inspire MG team for joining our session.
Okay.
You can go about with the session now, doctor. Thank you.
Okay. See, pediatrics is a very good specialty. I mean, a lot of subspecialties are also there in pediatrics. Once they do their post-graduation, that is MD pediatrics, they can branch out to other subspecialties like neonatology, gastroenterology, rheumatology, even emergency medicine. So there are a lot of subspecialties for them. And once they do their MD pediatrics, either they can go for teaching job. There are many upcoming medical colleges which require pediatrics, pediatric lecturers, so they can join them, or they can start their own practice in the neighborhood only or in the outskirts of the city where they are staying. So there are a lot of opportunities for pediatrics now. It's it's a very good branch to take up if they're interested after doing the MBBS.
So, doctor, first thing I would want to ask is, can you describe, starting from like what exactly pediatric specialty is, what it is all about, and also is it divided into many branches like other branches?
Yeah, pediatrics. It starts from from the day the child is born up to the age of 18 years. That is the pediatric age group. We take care of that. Okay, so it starts from the day the child is born. Then all the immunization, diseases per se, what we go through that 18 years, we take care of the children during that period. That is the pediatric specialty is about. So that is a general pediatrics. There are subspecialties where you can further do that, like endocrinology or neonatology or rheumatology. Those things you can, subspecialties you can afterwards do once you do your MD pediatrics.
Okay. What are the career opportunities for people that they have just completed NEET exams right now, right? So what is the career opportunity scope like for pediatrics?
See, that's what. Once they do their MD pediatrics, either they can start their own practice at that time. They can have a general setup either in the neighborhood or in the nearby places. They can get attached to nearby hospitals, admit the patients there, and then treat the patients there, treat the children there. Or they can study further. They can either do the fellowship in neonatology or endocrinology. They've got a neurology also. They can study further, and then they can get attached to major hospitals and then work as a consultant there.
Okay. And so what do you think is like main challenges for people who pick pediatrics as specialty? What is the work-life balance like? And what is something like, what is the salary? Some more details for this specialty?
Yeah, they should be interested in the field before entering the pediatrics, because because they should be able to know. They should be able to handle the children, because most of the children will be crying. Difficult to examine the children when they are crying, so they should be able to pick up the signs at that time. So they should be comfortable dealing with the children. That is one thing. And then career opportunities is good. They can, I told you, they can start their own practice. And regarding the work-life balance, it depends upon how many hours you want to work. So if you want to work from morning to evening, then you can take off in the night. If you got any emergency cases, you can attend the emergency cases. And then nearby hospitals, you can get attacked, admit the patient, and then treat the children. That is what. Work-life balance will be good. There is no problem, unless you go for emergency medicine, where you have a lot of calls, and neonatology also, where you have a lot of calls in the night also. Other branches like pediatric neurology and pediatricology, even cardiology, we don't have any much emergency cases.
Okay. So, so how difficult is it for people to manage the patients, like compared to, because this is the child group they are dealing with, what specific difficulties that they might face generally?
Because they should, because the dosage is not fixed, it depends upon the body weight. So you should know the dosage schedule for each this one drugs and what are the drugs to use at that time. And even the IV fluids, it should be maintained because it depends upon the body weight. So that is one thing. It is not like generalized in the adults. What you use it. And I told examining the child is difficult when particularly when they're crying. So you should be able to pick up the signs at that time. And you should have a lot of patience dealing with the patients. It is not like adults. You'll have to have a lot of patience. It takes a lot of time. You'll have to talk to the parents. You'll have to get the history from them. So they have then you'll have to examine the child. So more time will be consumed when examining the children at that time, rather than the adults.
Okay. So we can say that there is flexibility in work-life balance. And once you see that you're interested in the specialty, it's a convenient option. So that's what, okay. So anything else you can tell us more about the specialty, doctor? I don't have any specific questions. Like you can go on and tell us much more detail if you can.
No, this is actually a good specialty because you can see the patient growing in front of you. I mean, you'll be very happy when you see the children growing in front of you. I mean, going into different careers because most of them, they can become either musicians or painters. We have seen a lot of children like that. So seeing the growth of the children in front of you, it's a very good, this one. So it gives a very good, you'll be very happy seeing those children growing up and what you have helped them to do. So that's a good field actually to come on.
That's so nice to hear, doctor, because I personally, I have a 3-year-old and I visit pediatric doctors every now and then. So it's nice to hear from the doctor's side how it is. So any other insights for people who want to pick specialty pediatrics? Anything else you want to talk about?
Nothing specific as such. If they're interested in that particular field, it's a good field to come on.
Okay, doctor. Any details on salary package? Anything that you want to give us a bracket of when they're starting or after a few years of continuing with the specialization? What is it like?
See, when they finish their MD pediatrics, if they go for a teaching job like assistant professor or anything, then they get a salary around 70,000 or 80,000 at the beginning, I think. Then it goes on increasing. They have an increment every year. Suppose if they join a private hospital or this one, I think the starting salary is around 80,000 to 1 lakh initially. Then every year there'll be an increment. But if they start their own practice, then there is no limit for that. It depends upon how much hours you put up in the practice and how you establish the practice. So there, the earning will be more. You can involve more time and then the earning will be more in that.
Okay, and what further career opportunities they can have or any other details for that? Like what else can they do?
I told once they finish their MD pediatrics, if they want to study further, they can do the fellowship in different fields if they're interested. Because RUHS, Rajiv Gandhi University has a fellowship program where it will be in neurology or neonatology or endocrinology also. So if they're interested, they can specialize in those branches and then further establish the practice.
Okay, thank you so much for giving us all of these insight on the specialty, doctor. Any last message you have for our audience?
No, nothing else. Thank you. Thanks for thinking.
Thank you so much, doctor.
Thank you.
Thank you.
Thank you.